Ketogenic diet help with the coronavirus? I'm Dr. Brett Scher, the medical director at dietdoctor.com. And in this crazy, unprecedented time when the whole world is really trying to find some sliver of hope of how to prevent or treat a novel infection, a lot of attention has turned to nutrition. And I recently wrote a post that we covered here on YouTube and posted on dietdoctor.com about what does the evidence say about boosting your immune system. And part of that, I addressed nutrition, but I've been getting more questions specifically about what does a ketogenic diet do, and is there something beneficial about it to either prevent infection with the coronavirus or prevent complications. So to get one thing out of the open right off the bat, there's obviously no study about nutrition in this novel coronavirus. We have no idea. But there are plenty of studies out there that we can try and pull from to say, well, how does this affect our immune system and how might it affect certain infections? And interestingly, as I was looking into this, I found a study back from the 1930s where investigators looked at a ketogenic diet for treating urinary tract infections. So this isn't the first time this question came up. They thought it was probably helpful as it turned the urine acidic and made it with the acetone coming out, but that's a completely different story, completely different infection. But very interesting that this isn't the first time it came up. Now, what we eat clearly can affect our immune system. There's no question about that. So it makes sense that there might be a relationship. Now, one study that's been getting a lot of attention is a recent study in mice who were inoculated with influenza, and half of them got standard mice chow and half of them got a ketogenic version of the mice chow. And those who had the ketogenic versions had improved function of a T cell, which is a sort of an immune cell, in their lungs, which reduced their manifestation of the infection of influenza. Now, this is an interesting study because it shows the importance of how to measure immune function, right? It measured the T cell function, which is important, but it also measured whether or not they actually got the infection. And that's what we care about, because there are a lot of studies that will measure, a specific immune function, but not actually measure if you get the infection or not, or have a complication from the infection, whereas this one did. So that's pretty reassuring, but of course it was in mice. So ketosis in mice may be different than ketosis in humans, and immune system, immune function, lung function, response to viruses, all very different from mice to humans. So although that does have some encouraging information, it's still a big jump to say it's going to be the same in humans. Now, there's also evidence that ketones themselves can inhibit what's called the NLRP3 inflammasome, which is felt to be an inflammatory process in the body. And part of the complication once you get coronavirus infection can be an extreme inflammatory response. And that's where the ARDS, the lung disease, can come from a heightened inflammatory response. So inhibiting that could potentially be beneficial. No evidence to say that it clearly is, but theoretically, connecting the dots, it could be. And here's what's different, because that would have to be a ketogenic diet with a higher level of ketones, because it's the ketones themselves that inhibit the inflammasome. The other part, though, and this is where I think we have the strongest evidence, is one of the biggest risk factors for complications from coronavirus is type 2 diabetes or hyperglycemia. And it's hard to tease out the difference in what limited evidence we have so far. But older evidence, whether it's post-surgical infections or diabetic foot ulcers, or really any type of infection, hyperglycemia, high blood sugar, is independently associated with a higher risk from those infections. So it makes sense that controlling blood sugar is of paramount importance if you are acutely infected with coronavirus, and possibly even to prevent the infection in the first place. The data is a little bit weaker. But what's the best dietary means of controlling hyperglycemia? Well, now we know with lots of solid evidence, it is a low-carb ketogenic diet is the most effective nutritional intervention for controlling hyperglycemia and normalizing blood sugar. So from that standpoint alone, a ketogenic diet makes sense, especially if you have diabetes or abnormal blood sugar control, to keep that under strict control in this time of risk. Now, another interesting thing, though, is when should you go on a ketogenic diet? And during an acute infection is probably not the best time, because there is a transition period, that keto flu period, where your body switches from burning carbohydrates to burning fat and producing ketones. And during that 2-week period, you may feel worse. You get the keto flu, so to speak, which we've covered a lot at our website, dietdoctor.com. But so an acute infection, to be honest, probably isn't the right time to switch over. But in preparation, if you're feeling well, you're feeling healthy, I don't see any reason why you shouldn't. Now, the summary, of course, is, look, I can't prove it's going to reduce your risk of catching an infection or reduce your risk of a complication, but there's enough out there to make sense. I mean, any diet that is nutritious and gives you all the nutrients and minerals that you need, and the protein and the energy, and controls your blood sugar, I mean, that certainly sounds like a fantastic approach in these times. So if you're already on a ketogenic diet, don't worry about it. Keep doing what you're doing. You're doing great. If you're considered starting a ketogenic diet and you're feeling well, there's no reason not to at this point, as long as you're feeling well. You can go to dietdoctor.com, check out our 2-week keto challenge, our 5 weeks of keto. We have a number of different programs to get you started. And during this time, obviously, the most important things are keep up with your personal hygiene, with the hand washing, with getting sleep, getting outside and getting some fresh air and a little bit of exercise, taking care of yourself, taking care of others, prioritizing our mental health and our sanity during these difficult time periods. If we work together as a country, as a community, as a family, we can all get through this. Take care of yourselves, take care of others, and especially be mindful of the healthcare providers on the front line and our healthcare system trying to fight this epidemic. Thank you very much. Make sure you click subscribe down below to get other updates, and visit us at dietdoctor.com for more information. Have a great day and stay safe.